Hello and welcome to another telehealth information video. My name is Garvin and today's video is about implantable cardioverter defibrillators. An implanted cardioverter defibrillator or ICD for short, is a small paper-sized device which is implanted in your chest. Its use is to prevent death from cardiac arrest due to life-threatening, abnormally fast heart rhythm. So ICDs work by detecting and stopping dangerous abnormal heartbeats. An ICD continuously monitors your heartbeat and delivers electrical shocks to restore a normal heart rhythm when necessary. When you experience a rapid heartbeat, the wires from your heart to the device transmit signals to the ICD to send electrical pulses to regulate your heartbeat. Depending on the problem with your heartbeat, your ICD could be programmed for one of the following therapies. In low energy pacing therapy, you may feel either nothing or a painless fluttering in your chest when your ICD responds to mild disruptions in your heartbeat. In cardioversion therapy, a higher energy shock is delivered to deal with a more serious heart rhythm problem. You might feel as if you've been thumped in the chest. And lastly, defibrillation therapy is the strongest form of electrical therapy used to restore normal heartbeat. During this therapy, you may feel as if you've been kicked in the chest. It may knock you off your feet. The pain from this therapy typically lasts only a second, and there should be no discomfort after the shock is over. ICDs are advised for people with certain heart conditions and those who have had ventricular tachycardia, survived a cardiac arrest, or have fainted from ventricular arrhythmia. However, to be certain whether you need an ICD or not, your doctor may perform a diagnostic test. The test could be one of the following 5: an ECG, Echocardiography, electrophysiology study, and heart monitoring or event recording. In electrocardiography, or ECG for short, sensor pads with wires attached called electrodes are placed on your chest and sometimes limbs to measure your heart's electrical impulses. Your heart's beating pattern can offer clues to the type of irregular heartbeat you have. Echocardiography uses harmless sound waves that allow your doctor to see your heart without making an incision. During the procedure, the small plastic instrument called a transducer is placed on your chest. It collects reflected sound waves from your heart and transmits them to a machine that uses the sound wave patterns to compose images of your beating heart on a monitor. These images show how well your heart is functioning, and recorded images allow your doctor to measure the size and thickness of your heart muscle. During an electrophysiology study, or EPS for short, electrodes are guided through blood vessels to your heart and used to test the function of your heart's electrical system. This can identify whether you currently have or may develop heart rhythm problems. A Holter monitor records your heart rhythms for an entire 24-hour period. Wires from electrodes on your chest go to the battery-operated recording device carried in your pocket or worn on a belt or shoulder strap. While you're wearing the monitor, you'll keep a diary of your activities and symptoms. Your doctor will compare the diary with the electrical recordings to try and figure out the cause of your symptoms. Lastly, your doctor may ask you to wear a pager-sized device, also known as an event recorder, that records your heart activity for a day or so. Unlike a Holter monitor, it doesn't operate continuously, and you turn it on when you feel your heart is beating abnormally. So your doctor will give you specific instructions on what to do immediately before your surgery to prepare. It's likely you'll be asked not to eat or drink anything for at least 8 hours before your surgery. There are some risks with ICDs involved, as there are with all other medicines and medical devices. Particular risks include infection at the site where your ICD was implanted, allergic reactions to the medication used during the procedure to implant your ICD, and swelling, bleeding and bruising where the ICD was implanted. This is not a complete list of the possible risks, and you should consult either your doctor, pharmacist, or the included medicine guide for more information. Remember, all medicines have potential risks, but this doesn't mean that you'll experience them. So that brings this video to an end. If you have any questions, make sure to leave them in the comments below or contact me through lynchespharmacy.com. Thank you for watching. Stay healthy and stay informed.